Sudan virus causes what's called a viral hemorrhagic fever. It generally results in a case fatality rate of 40 to 70%. There are no vaccines or drugs to help prevent the disease or to treat the disease. And vaccines are able to really take control of an outbreak and quell it as quickly as possible. So they're a valuable tool in the response. Having vaccines would really definitely help us to shorten the length of the epidemic as quickly as possible. So basically, when the outbreak started in early 2025, we were able to provide about 2,000 doses of investigational vaccine to the Ugandan health officials and the WHO. The WHO conducted what's called a ring vaccination trial, and that's basically where you vaccinate the contacts of a case and you form clusters around that case, and then those clusters are randomized into people who get vaccine immediately or 21 days later. And it's an effective way of trying to determine the efficacy of a vaccine, and was used for the Ebola Zaire outbreak in 2014, where we were able to show that that Ebola Zaire vaccine called Ervebo was highly efficacious. We were able to start a clinical trial in 4 days, which I think is pretty much unheard of. And the team worked really hard to make that happen with collaborators in Africa and, of course, the WHO. And the way that we were able to do that is that we did have pre-approved protocols that were already written. There was vaccine in country that we were able to approve for use in the trial. And then we had a very collaborative and coordinated approach for how we worked together to start the trial as soon as we possibly could. And because we were able to act quickly, there were no cases of Sudan Ebola virus that were spread outside of Uganda. And we're hopeful that this experience will provide a blueprint for outbreak response. We still have work to do, and we're thinking about how to have investigational stockpiles regionally. But we're hopeful that we're getting better each time the outbreaks occur. We're learning more and more, and we hope to be able to respond as quickly in the future.